George came into work on a typical day at the laboratory located in a hospital. George was an efficient worker, but sometimes he worked too fast at his moderate to low volume hospital. It was getting towards the end of the day, and George was thinking about how great it would be if he was home. He received a urine sample with an order, but the sample was missing the second patient identifying number, which was the medical record number. Should George have rejected the sample and called the nurse to request a new one? George did the urine analysis on the sample, and it came back completely normal. The patient shared the same name with another patient, so when George entered the results into the system, he accidentally entered them under the wrong patient. He did this because he didn't have the medical record number on the sample to use to verify the right account. The physician called the laboratory for the results, and George did not have a legitimate explanation for the missing results on the patient the physician was asking about. George should have rejected the sample and called the nurse to request a new sample. George was suspended after this pre-analytical error for not following laboratory protocol and releasing results on the wrong patient. George should have been more responsible about his duty as a clinical laboratory scientist. The correct patient had to return to the hospital and give a new sample to be tested, thus delaying his diagnosis.